How to prepare for breast surgery. Outline. What tests do I need? What medications, pills, should I stop? When should I stop eating and drinking? Other important tips. Preparing and planning for surgery. Before your surgery, you may need pre-surgery tests, blood work, ECG, heart test, chest x-ray, anesthesia consult, and/or medical consult. Medications and supplements. 5 days before and 5 days after your surgery, don't take aspirin and prescribed blood thinners, fish oil, omega supplements, pills, garlic supplements, vitamin E supplements, herbal remedies, and other supplements. The first group, aspirin, prescribed blood thinners, fish oil, omega, garlic, and vitamin E supplements, are all stopped for the same reason. They can cause excess bleeding during the surgery. Herbal remedies and other supplements are stopped for a different reason. We're not sure how they may interact with other medications or anesthesia, so just to be safe, we recommend stopping these 5 days before and 5 days after surgery. 2 days before and 2 days after your surgery, don't take anti-inflammatories like Advil, Motrin, or ibuprofen. They also can act as blood thinners, causing increased bleeding during the surgery or after. You can take Tylenol, acetaminophen, until midnight the night before your surgery. It's a different type of medication, so it's safe to do this. The night before surgery, do not eat anything after midnight. The day of surgery, you can drink clear fluids until 5 hours before your surgery. Clear fluids include water, tea or coffee with no milk or sugar added, apple juice, and clear broth. If you take medications in the morning, discuss this with your team. Don't forget, leave valuables like jewelry at home since they can be stolen. No makeup. No nail polish since you will have sensors on your fingers and nail polish can obstruct the reading. No contacts. Glasses are fine. Have someone to drive you home because you'll be groggy from the surgery and it isn't safe to drive. Know about your mastectomy and lymph node surgery. Outline. What happens during a mastectomy? What happens during a sentinel lymph node biopsy? What happens during a lymph node dissection? What happens after surgery? How do I care for my incision and drains? What should I watch out for? What bras should I wear? Mastectomy. Mastectomy is a surgery where we remove all of the breast tissue. Usually we remove some of the skin as well as the nipple and areola. After a mastectomy, we also put in a post-surgical drain. Sentinel node biopsy. If you're having a sentinel node biopsy, you will be taken to the nuclear medicine department, 6th floor, Mount Sinai Hospital, for the injection of the radioactive dye. Sentinel lymph node biopsies are done when there's no sign that the cancer has spread to the lymph nodes. We use different kinds of dyes to help us flag which lymph nodes are the sentinel or the gateway lymph nodes. These are the lymph nodes that drain the most fluid from the breast. The first dye, as I mentioned, will be injected at Mount Sinai Hospital and is shown in the first picture. The radioactive dye is injected into the area where the tumor is. That dye will travel to the lymph nodes underneath your arm. This can happen the afternoon before the surgery or the morning of the surgery. You're not radioactive and don't need to do anything special after this dye is injected. Some women do have some pain or discomfort at the injection site. The second part of this procedure happens while you're asleep on the operating room table, and it's the injection of a second blue dye. It's called this because it's blue. It's important to know this because you'll notice that you may have some blue around the skin on the mastectomy incision, and you'll pee blue-green for the first few days after surgery. Both of these dyes work together to flag the sentinel or the gateway lymph nodes. The surgeon will use a probe that senses the radioactivity, and whichever lymph nodes are the most radioactive will be removed during the operation. Everybody's body is different, so the number of lymph nodes can vary person to person. This woman had 2 lymph nodes removed during the surgery. Axillary node dissection. An axillary node dissection is done when we know that there's cancer that has spread to the lymph nodes. The goal is to remove the cancer that's spread there. The surgeon in the operating room will remove the lower 2 levels of lymph nodes from your underarm. You will still have some lymph nodes left. The number of lymph nodes can vary. Anywhere from 10 to 30 lymph nodes will be removed. Similarly to the mastectomy, a post-surgical drain will also be inserted with this surgery. Surgery notes. The surgery you discussed and signed consent for is the surgery that you will have. A mastectomy with nodal surgery, 2 hours for one side and 3 to 4 hours for both breasts. Reconstruction will add time to the mastectomy. Recovery room. You will stay here for 45 to 90 minutes. You will have an IV, intravenous, which is used to keep you hydrated, as well as give you any medications you may need in this area. For example, if you are having pain or nausea, they could give you medications through the IV. Your surgical site is closely monitored. The nurse will make sure that your dressings are on properly and that your drains are working. You will stay in this room until you're ready to be transferred to the short stay unit and then home. Discharge. For mastectomy, you will stay overnight. You go home the next day with home care. Usually discharge time is about 10 or 11 in the morning. Bring appropriate clothes. Usually it's easier if you wear something that buttons or zips in the front because it can be difficult to lift your arms right above your head after surgery. Bring a responsible adult who can drive you home. The doctor will give you a prescription for pain medication. Typically, this is Tylenol number 3, Tylenol and codeine, or Percocet, Tylenol and oxycodone. An important thing to know about these medications is that they can be very constipating. It's a good idea to take a stool softener when you're taking these medications. Your surgeon may prescribe one, or you can pick one up at your pharmacy. Another tip for managing your pain at home is to be proactive or stay on top of your pain medication. If you've heard of the pain scale before, 0 being no pain and 10 being the worst pain ever, you want to take some medication when your pain is a 5, 6, or a 7 out of 10, not when it's a 10 out of 10. If you take medication when your pain is a 10 out of 10, taking a strong pain medicine like Percocet may only bring it down to a 6 or a 7, and then you're still quite uncomfortable. It's a good idea to take medication when your pain is at a 5 or a 6 to bring it down to a comfortable level. Follow-up after surgery. You will meet the surgeon about 2 to 3 weeks after surgery. Your pathology report will be ready and discussed. Referrals to other breast cancer doctors will be sent if needed. Incision. A mastectomy incision goes across your chest. Your lymph nodes are removed through the same incision. The incision is closed with dissolvable stitches. Axillary node dissections are sometimes closed with staples. Dressings over steri strips. Gauze and tape. Remove after 48 hours. Steri strips. Keep on for 14 days, then you can take them off. If they fall off before, this is okay. When can I shower? Do not shower for the first 48 hours after surgery. You can have a sponge bath. After 48 hours, you can remove dressings and shower, but avoid soaking the incision. Use mild soap. Swelling. Swelling around your incision is normal. Usually takes 3 to 6 weeks to decrease. It's not uncommon to get a golf ball of swelling in your underarm where your lymph nodes are removed. This can take some time to go down and is often more uncomfortable than where your breast was removed. If swelling is large and hard, contact the nurse coordinator. Don't apply ice or heat to the area where you had surgery, since the area may be numb and you could burn yourself without knowing. Infection. Not common, but important to watch for. Signs and symptoms of infection. Redness, heat, pus or discharge, new pain, hard swelling, rapid new swelling, fever, 38 degrees or higher for more than 24 hours. If you think you have an infection, seek medical attention. Monday to Friday, call the nurse coordinator. On the weekend, see your family doctor, a walk-in clinic, or the emergency room. Bras after surgery. No bra is needed. Post-mastectomy camisoles can be worn with soft prosthetics. Shirts that button or zip can be easier. Caring for your drain after breast surgery for patients having mastectomy and/or an axillary node dissection. Outline. What are Jackson Pratt JP drains? How do I care for my drain? Home care. Jackson Pratt JP drains, only used for patients having mastectomies and/or axillary node dissection. For mastectomy, you will have 1 or 2 drains. For axillary node dissection, you will have 1 drain. The drains are stitched into place on your chest or under your arm. Drains are used to prevent fluid buildup at the incision. Drains hold up to 100 milliliters of fluid. Blood clots, red blood cells, and tissue in the drain is normal. The color of the fluid coming out will change over time. Caring for your drain. Milking or stripping the tube should be done every 3 hours. Doing this helps the drain work. Empty the drain at least 2 times a day. Also empty the drain when it's full. Record the amount you are emptying. Home care. If you have drains, you will have a home care nurse visit. This is organized by the surgeon before you leave the hospital, sometimes in-home or at a clinic near your home. Drains are removed when the amount coming out is less than 30 milliliters for a day, 2 days in a row.